Hello, my dear friends. I'm Dr. Ramani, a men's sexual health specialist. Today, we are going to talk about something very open, very gentle, and yes, a little blush-inducing. It's one of those quiet conversations that many older adults carry inside their hearts, but rarely get the chance to speak about freely. It's time to bring those private thoughts and silent questions out into the light. When we talk about intimacy with honesty and calmness, we do more than just learn information. We release old fears. We ease long-held worries. We feel lighter. We connect more deeply with ourselves and with the person we love. And most importantly, we realize we are not alone in our experiences or our curiosity. Welcome back to this warm little corner of the internet. This is our space. A safe place where we talk about real intimacy without shame or embarrassment. A place where aging is not something to fear, but something to understand with confidence and grace. A place where we focus on keeping the body strong, the mind active, and relationships joyful, playful, and full of life. Whether you are watching from a busy apartment in Lagos, a quiet garden in Nairobi, or a peaceful retirement community in Florida, you belong here. No matter where you live, no matter your background, this conversation is meant for you. Here is a simple truth that I want you to remember. Intimacy does not retire. Desire does not suddenly disappear with age. Passion has no expiry date. And love often grows deeper and more meaningful when we care for each other with openness, kindness, and curiosity. So let us move straight into today's big question. One that comes up much more often than most people realize. Is it safe to swallow vaginal fluids during oral intimacy? What about the taste? What about the smell? Is it normal? Is it healthy? Is it acceptable? These are the kinds of questions people whisper to themselves. They type them quietly into late-night searches. They ask softly in a doctor's office while staring down at the floor. Today, we will talk about this clearly, gently, and without shame. If you feel tempted to click away because the topic feels a little uncomfortable, I gently ask you to stay. This will be an honest, medically grounded, warm, and sometimes even light-hearted conversation. By the end, you should feel more informed, more relaxed, and most likely more connected to your partner and to your own body. Before we go further, tell me in the comments where you are watching from. Share your city, your town, or your village. I truly enjoy seeing the worldwide circle we are building together here. It reminds us that questions about intimacy, health, and connection link us across cultures, borders, and generations. We are more alike than we think, and please remember to check the description later. I've placed simple and practical resources there for men and women in their mature years who want more confidence, better stamina, and a stronger sense of presence in their relationships. Small improvements can make a big difference. Let us begin with an important cultural truth. Oral intimacy is no longer the hidden taboo it once was. Across the world, couples are becoming more open and comfortable with it. From the lively streets of Cape Town to the calm green hills of Yorkshire, partners are embracing it as a way to bond physically, emotionally, and even spiritually. I have personally met couples in their 70s who experienced it for the first time and laughed like teenagers, like newlyweds discovering each other all over again. They told me it felt like a brand new chapter had opened in their relationship. That kind of joy is beautiful. It reminds us that discovery does not end with youth. And like every intimate practice, it deserves clarity, understanding, and care. Because when something enters your body or your partner's body, knowledge matters, comfort matters, safety matters. So let us gently unpack the questions that many people have always wanted to ask, but never felt brave enough to say out loud. What exactly are vaginal fluids? Are they safe to swallow? What influences their taste or smell? And most importantly, how do you keep intimacy not just pleasurable, but also safe, respectful, and affirming for both partners? Why do men so often raise this question? Because during oral intimacy, men directly encounter vaginal fluids. They taste them, they smell them, they feel them. Naturally, the mind asks, is this safe? Is this normal? Many men grew up in times when no one talked openly about these topics. There were no calm conversations, no honest education, just silence. And when silence fills the space, myths and jokes often replace real information. Confusion grows. That silence can slowly turn into shame, and shame often leads to avoidance, distance, or unnecessary fear. But intimacy should never feel like fear. It should feel safe and trusting. Women have questions too. After menopause, after childbirth, or simply as the body changes with time, many women begin to wonder about scent, taste, and moisture. They quietly ask themselves, is something wrong with me? Has my body changed too much? Am I still normal? Let me say this clearly and gently. Curiosity about your body is healthy. Asking questions is not weakness. It is wisdom. It is maturity. It is self-respect. When you ask questions, you are not showing insecurity. You are taking responsibility for your health and your relationship. That is strength. So if you have ever wondered about these things, please know this. You are not strange, you are not alone, and you are certainly not the only one thinking about it. These conversations are simply part of being human, part of loving someone, part of growing older with awareness and care. And today, we are going to talk about it together, calmly, respectfully, and without embarrassment, just like trusted friends having an honest conversation. So, what are vaginal fluids really? They are not random moisture, and they are not something dirty, shameful, or embarrassing. They are simply part of the body's natural design. These fluids reduce friction, protect delicate tissues, help support sperm movement when conception is desired, and even outside of fertility, they signal comfort, safety, and readiness for connection. They are the body's quiet way of saying everything is working the way it should. Where do they come from? There are three main contributors working together. The Bartholin's glands near the vaginal opening provide smooth lubrication early in arousal. The Skene's glands near the urethra, sometimes called the female prostate, can add extra fluid during deeper arousal and are involved in female ejaculation for some women. The cervix produces mucus that helps maintain balance and moisture, changing texture and amount at different points in the monthly cycle. Together, these sources create lubrication that can be clear, slightly milky, or somewhere in between. It is a well-tuned system quietly preparing the body for closeness and intimacy. Taste and scent naturally vary from person to person. Hormones, hydration, diet, hygiene, stress levels, and medications all play a role. Eating fruits like pineapple or citrus may soften the taste a little. Strong foods such as garlic, heavy coffee, or alcohol can make it sharper or more bitter. Around menstruation, a light metallic note from trace iron is completely normal. A woman's natural scent and taste are not flaws or defects. They are part of her hormonal rhythm and personal chemistry. No two bodies smell or taste exactly the same, just like no two voices sound identical. Sometimes taste or smell feels different or slightly unpleasant, and that is common and usually easy to fix. There are a few frequent reasons. Heat and sweat can get trapped by tight, non-breathable clothing. A trace of urine may remain from rushed wiping or limited access to restrooms. And imbalances such as bacterial vaginosis, which often has a fishy odor, or yeast infections, which may have a bready or beer-like scent, along with thicker discharge, can also change things. These conditions are very common and treatable. Embarrassment only harms intimacy. Knowledge helps restore it. If something feels off, do not pull away in silence. Look for gentle solutions together. Hygiene done with kindness supports confidence. A quick rinse before intimacy using just water or a mild, unscented cleanser can help both partners feel fresh and comfortable. Think of it like brushing your teeth before a kiss. It is not about shame. It is simply about care and consideration. Cotton underwear allows better airflow than synthetic fabrics. Avoid douching or harsh scented washes, because these can disrupt healthy bacteria and often create more problems than they solve. And men, if you notice a change, do not joke or criticize. Choose kindness instead. Suggest a shared shower. Ask about comfort. Approach intimacy as a shared experience, not a performance or a test. Now we come to the core question. Is it safe to swallow vaginal fluids? The short and reassuring answer for healthy partners is yes. Vaginal fluids are a natural mixture of water, amino acids, enzymes, glucose, and lactic acid. They help keep the vaginal environment healthy, lubricated, and protected. In a relationship where both partners are healthy and free of infection, swallowing these fluids is not automatically dangerous. In simple terms, it is no more risky than deep kissing when it comes to normal everyday microbial exposure. However, there are situations where risk does exist. Sexually transmitted infections such as chlamydia, gonorrhea, syphilis, trichomoniasis, herpes, and HIV can be present in vaginal secretions. Mouth sores, bleeding gums, or small cuts can increase the chance of transmission. The risk of HIV from oral sex is generally low, but it is not zero, especially if there are fresh wounds in the mouth. The solution is not fear or panic. The solution is awareness. Know your health status. Talk openly with your partner. Test when appropriate. Make safety a shared value rather than an awkward topic you avoid. Barriers like dental dams or even a condom cut into a square can reduce risk and still allow pleasure. Some couples even make barriers playful by choosing flavors or bringing them naturally into intimacy. Here is a simple 3-step approach. First, talk about STI history before exchanging fluids. Ask, when was your last test and would you like to test together? Second, use protection when there is any uncertainty or risk. Third, make regular testing part of your overall wellness routine. For many sexually active adults, twice a year is a reasonable rhythm. When both partners are healthy and informed, swallowing vaginal fluids carries no special danger and can simply be another normal part of shared intimacy. Let us also talk about comfort and personal boundaries. Even if something is medically safe, it still must feel right for you. Desire cannot be forced or pressured. Consent matters at every age and in every relationship. Some people enjoy oral intimacy deeply. Others feel neutral or unsure. Honest communication protects connection and trust. If you do not enjoy swallowing fluids, it is completely okay to say so gently and respectfully. If you do enjoy it, it is also okay to express that. Intimacy grows stronger when preferences are shared without fear, embarrassment, or pressure. As we age, bodies change, but connection does not have to fade. In fact, many older couples report more satisfying intimacy because there is less rush and more presence. There is time to talk, to laugh, to explore, and to learn one another again. Oral intimacy can be a powerful way to maintain closeness when intercourse is limited by health issues, mobility changes, or comfort. It allows partners to give and receive pleasure without strain, and it often builds trust, tenderness, and emotional warmth. When both people feel safe, respected, and informed, intimacy becomes less about performance and more about genuine connection. I want you to remember these words. There is nothing dirty or shameful about bodies doing exactly what they were designed to do. Vaginal fluids are a sign of life, responsiveness, and good health. Questions about them are normal. Talking about them is healthy when we replace silence with understanding. Intimacy becomes lighter, safer, and much more joyful. So carry this conversation with you. Share it if it helps someone. Talk with your partner tonight, not with fear, but with curiosity and care. Aging does not close the door to pleasure. In many ways, it actually opens that door even wider. Thank you for being here with me, for your openness, and for choosing knowledge over silence. You are not alone, and your intimacy journey is still very much alive. It is simply another way of sharing closeness. There is also an emotional layer that often stays unspoken. Many men quietly ask themselves, is this respectful, or will she think less of me or judge me? Those thoughts sit in the background even when desire is strong. For many women, a partner's calm and grounded acceptance can feel deeply reassuring. It sends a message without needing any words. I trust you. I enjoy you. I welcome every part of who you are. That kind of acceptance often softens anxiety, increases arousal, and strengthens emotional connection. Intimacy after 50 or 60 is not only about technique or performance. It is very much about safety, reassurance, and feeling accepted without judgment. Variation in taste and scent is completely normal. Bodies are not machines, and they are not meant to be identical every single day. Hydration often makes natural fluids taste lighter and feel more neutral. A well-balanced, probiotic-supported diet can help maintain healthy flora and internal balance. Strong flavors from caffeine, alcohol, smoking, or heavily spiced foods can show up in body fluids, sometimes more than people expect. Hormonal shifts also play a role. Around ovulation, fluids may be more slippery and mild. After menopause, things may feel drier, thicker, or slightly tangier. None of this is a flaw. It is simply biology responding to time, hormones, and life itself. Stress deserves special attention. Ongoing stress can change the microbiome and intensify scent or sensitivity. When the nervous system is under pressure, the body often reflects it. If a persistent fishy odor or a cottage cheese-like discharge appears, it is best to think of it as a treatable imbalance, not something embarrassing or shameful. These are common issues, not personal failures. Seeking care together, calmly and practically, just like you would for any normal health concern, can remove fear and restore comfort much faster. Communication remains the bridge that holds everything together. If you feel nervous about bringing this topic up, gentle language works best, especially outside the bedroom. A simple sentence like, "I'd love for us to explore oral intimacy more. How do you feel about that?" keeps the conversation open without pressure. If she feels shy or self-conscious about taste or scent, reassurance matters more than technique. Saying something sincere like, "I love your body just the way it is," or "I want all of you," can make a powerful difference. Before intimacy even begins, slow pacing and affectionate touch help the body relax. Anxiety fades when someone feels unhurried and truly wanted. Even small shared rituals can shift the mood. A warm shower together, a gentle rinse, or simply freshening up side by side can turn nervousness into anticipation. Timing can help too. Fluids often feel clearer and milder around ovulation. After menopause, hydration and diet become even more important. Some couples create a simple ritual of fresh fruit and sparkling water beforehand. It is hydrating, symbolic, and lightly sweet, and it reinforces the feeling of being on the same team. Moments of release can feel especially vulnerable. If a sudden gush surprises you, the most important choice is presence rather than panic. Stay calm, breathe, remain close. A kind word in that moment carries enormous weight. Saying something like, "That was beautiful," or "I love how your body trusts me," can change the entire emotional meaning of the experience. One gentle response can transform years, even decades, of self-consciousness into a deep sense of freedom. Your steadiness in those moments strengthens her trust and often eases your own performance anxiety as well. Returning to safety and science, for healthy couples, swallowing is generally considered safe. Natural fluids are mostly water along with protective lactic acid and helpful enzymes. Contributions from glands in the cervix vary with arousal and hormonal cycles. Risk is not about the fluids themselves, but about infections or open oral sores. Honest communication, regular testing when appropriate, and good oral health form the real safety net. These are practical steps, not fearful ones. Taste and smell will naturally ebb and flow over time. That is not a problem to fix, but a reality to understand. Encouraging hydration, being mindful of diet, and making a shared rinse part of playful foreplay can keep things comfortable if either partner prefers it. If something feels noticeably off for more than a few days, checking in with a clinician is the wisest step. Treatments are usually quick and effective, restoring both physical comfort and emotional confidence. At the heart of all this is a simple truth. Intimacy in our later decades is not about acrobatics, novelty, or proving anything. It is about kindness, safety, and real connection. When you approach vaginal fluids with respect instead of fear, you communicate something powerful. You say, "I accept you fully." That message reaches far deeper than words or technique ever could. That is where the deepest form of intimacy truly lives. For men who want to go one step further in supporting their own confidence and physical performance, there are natural supplements that may help. Two that are often mentioned include organic watermelon extract, which is rich in L-citrulline and supports nitric oxide production and healthy circulation, and advanced blends containing ingredients like maca, tonkat ali, fenugreek, nettle, and citrulline. These formulas are commonly used to support erections, stamina, testosterone balance, and prostate health. As with anything, consistency and overall lifestyle matter far more than quick fixes. Thank you for watching, and I will see you in the next video.